On today's episode of When Does It End, Tori and Chris will be doing a deep dive into the world of self-testing. The pandemic taught us that HIV education, testing, and prevention doesn't always have to happen at your local community-based organization or clinic. When the world decided to shut down, many organizations got innovative in their approaches to HIV prevention. Today, you will hear how some people use the pandemic to reach and encourage more people to know their status. What's up? Welcome back, family. It's Chris Walker and Tori Cooper, and we are bringing you a live, in-person, quick, another episode of When Does It End? We have some amazing co-hosts today, and we're going to be talking everything self-testing. You heard it right? Self-testing. And if you don't know, I guarantee by the end of today, you will. Tori, what you got to tell the people?
Hey everybody, welcome back to our podcast. Chris and I are so excited to welcome you in a COVID-free environment. We've all been vaccinated and are excited to be here and are still following safety protocols. And we really want to extend a welcome to men folk, women folk, all folks, because you're our folk. So why don't we give a little space for all of our amazing guests to introduce themselves, tell us who they are, what they do, and where they do it, and what your pronouns are.
My name is Jalen Hibbert. I prefer he, him pronouns, but I'm open to all of them so long as they're used respectfully. But I am the HIV testing coordinator at Reach LA in Los Angeles, downtown. And So as a testing coordinator, I manage a lot of the testing. I work closely with our testers and the community. And the reason why I do it is just because I'm community. To be honest, Reach LA has always been a safe haven for people in the ballroom community. So that's how I was introduced to Reach LA. And further down the line, fast forward, when they were looking for employment opportunities, that's when I jumped into the field and had a lot to learn. I started as a tester, and 2 years and some change later, I'm in the position that I'm in now. So I have a lot to learn, but I'm also happy to just be in this position at a table where I can make decisions for people in my community, because I honestly didn't have this when I was a teeny bopper coming up in the world. So it's just really important for me to just be able to be an outlet or asset to the community.
Hey y'all, Vanessa Castro, she, her pronouns. I am the Associate Director of HIV and Health Equity at the Human Rights Campaign. And I do what I do because at the end of the day, I'm gonna keep it simple. It's gonna take all of us to end the epidemic. So that's kind of why I'm in it, and we still have a ways to go, but looking forward to talking to y'all today.
I first want to start off by saying that y'all are the GOATs. Y'all too. I am so honored to be here with these two individuals. They inspire me every day. But I'm Jonathan Ford, he, him pronouns. I am out of Dallas as well. I'm a HIV advocate, and I'm my CBO affiliation is with Center for Health Empowerment.
Thank you and welcome.
I'm Devin James. I am the executive director and founder of the Velvet Arts Project. So we do HIV awareness, mental health, and suicide prevention through arts, culture, and advocacy. I'm also in Dallas and just really do what I do because, like Jamie said, like I am the community. I've been a part of the community. I know what the needs are, and I just want to be, somebody that I didn't have when I was growing up. So.
Awesome.
Thank you.
Thank y'all for being here. I love seeing young people get a part of this work, because a lot of times, with being a young person myself, navigating HIV prevention and becoming an emerging public health practitioner, sometimes there's a lack of opportunity. Sometimes we don't see ourselves in positions of leadership. So for me to see here amongst you all in camaraderie, to see all of you all forging your own path, but also searchlighting and being change makers for people coming up behind us is amazing. Thank you all for taking the opportunity to share space with us in this moment. I appreciate it, and granted, this is going to be amazing. But let's get into the meat of today. So Jalen, Vanessa, Jonathan, and Devin, are y'all ready to dish the tea and talk about what we came to talk about, which is self-testing? So for those of you who aren't aware, look, okay. Brought to you by Quick.
I smell an endorsement. I smell an endorsement deal, Chris.
No. So y'all, we know that HIV prevention has looked a little bit different. It's been weird since COVID-19. People were trapped at home for about 2 years, right? So people weren't going outside. Nobody was really getting tested. Nobody was really connecting to folk, and a lot of organizations were suffering and reaching their numbers, and community was impacted, right? So I was doing some research recently, and they said that there was a stabling in new HIV transmission rates over the past 2 years, but the data did not include that there was also a drop in HIV testing, and a part of that was COVID. And so to mitigate a lot of this disparity associated with the lack in testing, a lot of organizations started to do something new and innovative in their approach. They started to offer at-home self-testing kits. So in this moment, can y'all tell our viewers what is an at-home self-HIV test and how impactful can it be within community, especially now?
You brought a very, very good point. COVID, it shut everything down. Literally at the start of COVID, for the safety of staff, we had to close the door for community, which was hard because HIV testing is what we get grants for and all that good stuff, but our innovative approach is what gets clients to come in to access those services. So when we closed the doors, it wasn't just for testing. It was for our weekly Vogue class, our weekly runway class. It was for our discussion groups. It was for everything, but it was for our safety, so we had to. But we also recognized that there was a growing need that we wasn't able to address, which was testing. So there goes the innovative approach, where we implemented self-testing with the beautiful OraQuick test. So that was really just our way to respond to community. Folks didn't need to come into the office. They didn't need to see us. We did do phone calls because there was still a necessary counseling portion that was needed, because when people do tests, it's obvious that there's 2 results, and whatever the result is, then the client will be eligible for a referral, whether it's HIV care or PrEP. So for us, the OraQuick self-testing has just really been a great way for us to continue to provide services for the community and to also do it in a safe way.
Thank you. Does anybody else have anything they want to add before we continue to move forward?
So self-testing is really just self-explanatory, giving an individual the opportunity to test themselves, like in the comfort or safe space of their home or wherever that may be. It's not organizations sending a tester out to the house. It's not that. And it's interesting that I'm glad we're having this conversation, because a lot of organizations in Dallas primarily are having trouble with the self-testing, rolling it out, and like, what does that look like? So I'm just glad we're having that conversation today.
And so, stemming from this, I want to open up a healthy dialogue, because you just said a lot of places in Dallas are struggling, right? But you said adversely it's working for y'all, right? So,
Go ahead.
So I want to know, what is that caveat? So for folks looking to engage or start a self-testing program, how can we find the mediating space to get it to work, right? Because as you said, in Dallas it's not working, but it's successful. And so what is needed, or what does an organization have to do? Or what type of capacity building structures need to be implemented or created for this to be a valuable option and be impactful within community?
That's a great question. For us, it's been the response to the community. It's really just been a way to, like I said, to continue to provide this testing. To provide this service for community, for them to be able to still access it. And the reason for why it's been heavy for us is that when we reopened for services, the at-home testing kit has still been kind of like the breadwinner for us. So people still come in and get testing, because we have that. We do STI testing, we do HIV testing all throughout the week, but that at-home testing kit is just a lot more effective, because some people aren't comfortable with coming and being in these open spaces with folks. So it still provides the opportunity for people to access health services all at the comfort of their own home. And also, I don't know about y'all, but with our clear waiver and all that, we're only able to test at our offices with the storefront testing, Insti, but the OraQuick allows us to outreach and to go into the communities. We're going to schools, to colleges, to different like presentations. Whenever we're outreaching, we let folks know of the services that we have, which is the OraQuick test. So that's one of the main reasons why it's been very successful for us, because it allows clients to continue to access services with us, and then it also allows us to find different ways to get to the community, because we've realized that's what it takes. You got to get to them.
And so, no, I was just like, I agree 110%. Like, my organization, Center for Health Empowerment, we haven't necessarily started rolling out self-testing. We're going through the phase of trying to get everything squared off. But yeah, I think that rapport with the community is so important. So, like, I really like the way that you said that. So.
And you know what's interesting? The tests don't take themselves. So it is important to have a rapport and some type of relationship with folks, because they need to trust us enough to say, this is something. They have to be comfortable. Thank you for saying that. So that because we're providing with something that has the potential to change their lives. Right. It has the potential to change their lives. We're here at the MMAX HIV Biomedical Summit, and that's how we all gathered in the same place today. And I heard one of the speakers today, I'm not sure what the intended reaction was supposed to be, but she talked about how low the place where she works, the low number of reactive tests that they'd gotten over the last year. And it frightened me. It frightened me not because people weren't having sex, not because people weren't getting HIV. It frightened me because that meant that there are folks who don't know that they have HIV, that they are not getting tested. We talked earlier today in one of the sessions that we heard that some people are never going to walk into a place that has AIDS on the front door to take an HIV test because of the stigma just associated with that. And you mentioned ballroom. You're part. Who is? I know there are at least 3 of you in the room who are part of ballroom. Okay, 3, 4, 5. Okay, Vanessa's honorary mother of this room tonight. All right, I'll be the sex siren, and you'll be the mother.
A little shade.
All right,
for free here first.
You got it for free. Oh, it ain't for free. You just don't see the payment. Right, but we know people in ballroom, many of whom are never going to go to a place public, especially if they're very visible, to get tested.
Right.
And so we did an event in Atlanta recently where we provided this for people who are in the ballroom community. Right. We did an event, we honored Mother Shay Chanel and brought in some of her friends.
Right. But some people never feel like in public anyway, like, you know, with that, letting people see you get tested, letting people know, like, you know, and if you do find out, like, in public, it's like, how am I going to react to this? How people going to see me? How people going to view all of that? So it's a lot of things that I feel like, you know, self-testing in the comfort of your own space can really benefit.
And I think that, and so as everybody was talking, this overarching thought was playing in my mind, like this phrase. Testing trauma is real. Mm-hmm. There is a level of trauma associated with going to get an HIV test, especially when you are a member of a community that you know is more accessible or more vulnerable to HIV acquisition. And so, like, I could even think about going to get tested back in the day, and like reluctant because I was scared, and like I was scared of what the result was going to be. I was scared of who saw me going into that space.
Exactly.
I was scared of having to be authentic and tell my true story to my physician because my physician didn't understand what I was doing sexually. Hell, I didn't understand what I was doing sexually. So I think it's important for folks within this space to know that testing trauma is real. And so OraQuick and at home and self-testing gives people more options. And I actually wanted to ask you a question, Vanessa, because you do a lot of equity-based work, right? Mm-hmm. So in the terms of being able to expand services, by being able to reach people in the comfort of the home, what does the possibility of at-home self-HIV testing do in the terms of equity?
Well, I think it's really important to note, and I think we've all kind of touched on it, it's not HIV that's killing us, it's stigma, right? So what this allows is it allows people, again, to have the opportunity to, you know, find the results, to build community, and to be able to find the next steps. So in terms of equity, some of us are from Texas. We know how big it is. It takes a minute to get to, traditional healthcare settings, right? Or it takes a minute to get anywhere, really. But I think it's really important to start to really bring into the fold the folks who may not have access to traditional healthcare settings, right? Like folks in rural communities who are in the Deep South, who are confronted with stigma, name all the isms, right? The phobias. And so I think it's important when we look through a health equity lens to ensure that who are we missing in this picture? And with the testing kit, it allows folks to just do it themselves, right? When they don't have, unfortunately, the folks that are supporting them within the healthcare settings, they are able to take action and kind of make that decision for themselves. So I think it's important when we talk about equity, like who are we missing in the picture, right?
And I think it's so important in terms of equity, and when we talk about access to make sure that everybody has equitable access to the resources that they need when they need them. And I think that in regards to traditional HIV testing going in clinic, normal clinical hours don't work for everybody. If I work a 9 to 5 and I had a sneaky link last night and I need to go get tested to see what's going on, I'm not leaving work to go get tested because I need my coins, Right. And so by the time I get off, there's nowhere to go. And let's just say I have another sneaky link, missed opportunity. And then going back to what you talked about HIV testing at the club, I'm out to drink and have a good time. I don't want to get no results. Exactly. Testing trauma is real. I remember when I was doing my first job in public health, I was doing NHBS, the National HIV Behavior Surveillance, and we were collecting qualitative data.
That was your first job?
That was my first job.
Bitch, that was my 6th job. Gracious.
My first public health job.
Okay.
My first job was McDonald's, okay? How you doing? The fry guy. No, but going back to like when I was doing outreach and I was literally collecting qualitative data for MSM. And so we were literally asking these folks as they were engaging in activity about their life, what they do sexually, but also testing them. And so there were so many times where I gave people positive tests and they didn't know how to handle it. Or they immediately ran. Or they went to the bar, got drunk, and had sex again after knowing their status, trying to cope with what was going on. So just being able to have access to be able to test on your own in your own way so you can come to terms with what you got going on. And I think that people try to push testing in people's faces, and I'm not about that. I'm a firm believer in making sure that people have a buffet and a menu of options and they can choose when they want to use them, because it's not for me to tell you this is what you need to do. It's for me to, hey, this is a resource. I'm going to walk you through this, and when you're ready, I'm going to be here to catch you. I'm going to be here to follow up.
That's good. Go ahead, Vanessa. You look like you're about to say something.
Yeah, I was going to say, I think I'm coming from a public health background also in health behavioral health education. You have to give people the tools to make that informed decision, right? But when they don't have the information to make those informed decisions on their terms, they're not going to make those changes, right? So it's important to, give people the resources, give them the tools, let them know that you're there to support them, right? Or provide them with the resources to support them. But at the end of the day, it's, the individual who's going to make the decision, right?
And there are two really powerful words that I've heard come up quite a bit already, and one is community. And why I think it's important for folks to hear community. Those of us who've done HIV testing, we're part of the communities that we serve. And so there are people who, because they know you, they don't want to take a test with you. Now, I was just going to say that also happens. Tell us a little about that.
So I did a lot of work at Resource Centers, United Black Element. So we create events and things like that to build community, mobilize everybody, bring everybody together. And so once you become a community and you feel safe and comfortable with those people, then it's easier for you to open up and talk about things that you're actually going through and actually tell the truth. Like if somebody asks you a question, it's like, oh, you come in and you're like, oh, I had sex with such and such. Okay, well, did you use a condom? You be like, you want the truth? Or so it's like you start really talking. Like when somebody becomes your friend, you feel a lot more comfortable. And so building that community really, like I said, it can either be like, oh, I don't want them to know my business or whatever. But once you really let somebody, you open up the space where everything is positive, to where it doesn't matter what you're doing, like you just know that I support you, then it makes it easier for me to get you the resources you need, because then I know what's really happening. And so I just think, like I said, like community is very important. And I feel like it's going to take us, and we only listen to other people like us most of the time anyway. So
Which is why I think folks who are like us are going to be so important in making sure that people get at-home HIV tests, because they trust us. Right. And we trust people who are like us or who we feel have something in common with. So your organization, in full disclosure, the organization we work for, because we don't own it. I just collect my check Actually, we get paid tomorrow. But I collect my check every 2 weeks, just like you do. But this is something that everybody felt was really, really important, that we integrate this into our services. And we're not a traditional provider of HIV services. Can you talk a little bit about why that's so important?
Yes, and as Tori mentioned, we're not a direct service organization, right? We're an LGBTQ plus civil rights organization, but we've realized the importance and just the need from community, right? Just talking to community in terms of what do y'all need in terms of testing, right? Access to be able to end the epidemic, and really working with community-based organizations. That's really been what's fueled this this program or this campaign that we've started. And right now we have a national program for in-home testing kits that we launched early on, but we're actually doing a relaunch this summer because we realized not enough people know that this is even an option that we have. And it's getting into the hands of folks who are requesting it, but not like our community, right? So we want to ensure that they're not folks being left behind in accessing the testing kit campaign. So right now we do have, and if anyone wants information, I'm happy to provide it. But I think what's really important is making sure folks have access to testing, right? They request their kits and then get immediately connected to somebody in their community. So we're working with a local CBO partner to help us kind of navigate this kind of direct services piece. But it's definitely something that we realize like we need to do more of, right? We have 5,000 kits that we're distributing. That's not enough. Like we need to do more. So our hope is that in this pilot program, where it's national and also going to Puerto Rico. So we've already gotten tons of kits requested, as Tori mentioned at her event. And right now, as we're kind of coming out of this COVID hiatus, if you will, and doing in-person engagement, we're really hoping to ensure that folks know that this is available, and it's something that we're doing right now. So that's kind of been the thing that's kind of pushed us to realize like we need to do this more often and we need more of them. So
while you have the microphone, tell us why it's so important to have a community-based organization, and they're Black folks,
yeah,
right?
Minority-led, minority-serving, and I think it's clear, right? Like that's been our mission in terms of HIV health equity, and part of the work that we're doing is we're changing the narrative, right? We're trying to ensure that folks who've been at the margins get the spotlight, because it's time. It's been about time. So our work is really focused and really driven by our community. We work with a lot of CBOs across the country. We're looking to get more partners, so if you're interested, reach out. But I think it's really important for us to ensure that these are the folks that have the seat at the table and are helping drive the dialogue and just the next steps, right? So for us, that's been something that we've been really striving to do every day. And this testing kit program, I think, has just been, folks have been excited. We've talked to people about it, and like, we didn't know y'all did this. And like, okay, well, we need to do a better job of messaging. So that's something we're working on. We're trying to get creative, and inspired by Reach LA's really creative take on being able to have conversations and just do things in a very like authentic way. So that's what we're striving for, in hopes that more folks will have access to the testing kits.
Awesome. We were actually going to invite someone who, if anyone felt like taking an HIV test on camera, and then I thought about it. I said, well, you know what? That kind of defeats the whole purpose of the anonymity that can go behind it. But we did think about it.
And so there was something that you said that I think deserves a rewind, retweet, and hashtag. You said minority-led and minority-serving. Mm-hmm. And so I think that we're going to go to a commercial break, but when we come back, that's where we're going to start, because I want to talk about the importance of collaborating a partnership.
Yes.
And doing service with minority-led organizations for minority focus. There are so many new initiatives that are coming out that really focuses on quality of life indicators when it comes to HIV prevention efforts. When we talk about creating community and literally going into community and letting community lead the development of community resources, that's really amazing. And so if you are a constant viewer of the show, you already know that we're going to tell you about EHE. But if you are not, if you don't know what EHE is EHE is the Ending the HIV Epidemic plan for America, and the goal is to really eradicate HIV by the year 2030. Now, there's been some recent data, and we may be a bit off, but I guarantee you the mission still remains the same, even though the time may be advanced a little bit. And so it's broken down into the 4 pillars of prevention, diagnosis, treatment, and responding. I'm going to say that one more time for the people in the back. It's prevention, diagnosis, treatment, and responding. Based on what I said, where do you all feel like the ability to be able to self-test yourself lies within our 5 pillars of ending the HIV epidemic?
I feel like it really falls under all of them. I mean, basically just really what you just said, because I mean, in response, like, responding to COVID and not being able to go out and get tested, now we're sending, self-testing to your home. Of course, prevention is getting you tested, so that way you do know your status and all of it. So, I mean, like, really it falls under every one.
Great response. It's a great response. And true.
And true. And it really is. I feel like a lot of times a lot of the things that we do in HIV prevention is very so much cyclical. It's a revolving circle, and everything kind of coincides to each other. Yeah. I think of it like the Mississippi River. And so, the Mississippi River flows through the United States, but also there's so many streams, there's so many channels that flow into that river, and then it flows into the ocean. So everything is connected. And I think that people need to understand and realize everything is connected. So how we show up in community, how community views us, our programming, how are we inviting, even those negative experiences that one person might have had within our organization, they're connected. So we have to be intentional in countering that narrative and being there to support community in ways that's acceptable for them in the time and appropriate space.
That was beautiful and so well said. So we're all branches on the river.
Here we are.
All of us have a part to play, and we're all connected.
I'm street water.
Thought you said street walker at first. Okay, that's fantastic. Okay, so so we all know. All right, so we have spent some time now talking about what at-home HIV testing is. And we've gotten some great feedback on how folks can use it in their own lives, how corporations, how companies, how CBOs can implement it in the outreach, how it really is just one additional tool that helps all of us get to the end of the HIV epidemic. So can we just take a couple of minutes to dispel some myths about at-home HIV testing and HIV testing in general? What's one thing that you've heard folks say in your community? Each of you. 1 or 2, 7, however you want to call it.
So to debunk some myths, I think one would be so even with these at-home tests, people were thinking, well, do I have to draw my own blood? So, and you have to kind of like break it down and let them, let them know what, what's the process like. I'm trying to think of another issue or anything else that we need to debunk. Does anybody else have anything?
One that I want to debunk, it goes with the test itself, and then also for folks who are HIV positive, that this test or your status is not just it. At Reach LA, we make sure that folks know that whether you're positive or negative, status neutral, that we have services for you. So it's not just taking a kit and doing it yourself and whatever the diagnosis is, you're on your own. No, it's important for us to do the counseling sessions so that people understand the process, which is you're going to do the test on your own because it's an at-home test. But the main purpose is so that you understand what your status is, so that you could get the proper referrals after that, whether it's linkage to care or whether it's PrEP service. So one big thing I wanted to debunk about HIV testing and at-home testing is that that's just not it. There's a lot more, and there's a lot more to it behind just doing the test.
And like I said, like to Chris's point, I don't know what California is doing, but they doing it right. But like it just kind of falls into, even with y'all adding linkage, like to link somebody, there has to be a report. Like if you send me an at-home test and I find out I'm positive, do I trust you enough to even come back in there? And are we taking a status neutral approach? If I walk through these doors, do they know what I'm here for, these other clients? It is so important. So I just wanted to like kudos to y'all out there.
And that is, I'm trying not to put up V right now, but I am.
Cut that out.
I think it's so detrimental to our work to make sure that people are being seen. And I feel like a lot of times that some people feel like they're only seen if they get HIV. And I know that in my line of work, that's led to people wanting to get HIV to be able to access services that they can get prior. So I think that now, as you talked about it, we need to be more intentional in pursuing status neutral approaches to status neutrality. So no matter negative or positive, if you come to test within my clinic or if you test using one of my at-home kits, you're going to have a conversation with someone on staff, and we're going to make sure that you are linked, period. I'm going to say that one more time, that you are linked, period. Negative or positive. And linked could be to link, and when I say linkage, I'm talking about things so much more than just biomedical prevention, right? So we know linkage to PrEP, linkage to PEP and ART, but linkage to food, linkage to medical transportation, linkage to community support groups, linkage to life skills, right?
And what we heard earlier today, because we're about to wrap up, but one of the things that we heard through one of the presenters today is that if someone comes in for PrEP, they're actually linking them to housing. Imagine that.
Right.
That there's a connection between housing and an HIV diagnosis or adherence.
Right.
Who would have thunk?
And so what I tell people is like, HIV is so much more than what you do. It's about how you live. You know, HIV is so much more than sex. It's about what your life looks like and what you have or don't have access to. And so, you know, it's something that you said. It's not just me. It's not just you. It's not just you. It's us. And collectively, we create this space, and collectively, we create the solutions, but only through that solidarity can we see a true impact in what HIV looks like within today's landscape. But I know with advocates such as you all coming up, we're going to get there. You know, we may not end the epidemic by 2030, but I know that we are setting the groundwork for us to truly see an impactful change in HIV within our lifetime. So you all, guess this is your wow moment, your words of wisdom. So if you could please share something that you would like our viewers to take home with them as they embark on the work that they do. And also drop your handle so that people can know how to get in contact with you. Because we want to get you booked and we want to get you paid. All right.
I know that's right. So again, Jonathan Ford, my Instagram handle is lord.ford. Zeros. So lord.ford. And my words of wisdom would be to never give up on pursuing your dreams. And I think that when it comes to passion-filled things in your life, those type of, even the obstacles aren't really obstacles. And when it's something that's for you, it'll choose you and you don't have to choose it in a sense. So yeah.
So again, I'm Devin. You can find me. My handle is _Devin the dude _. My words of wisdom is really just, you can't really control anything but yourself. So when it comes to your health and all of that, you got to make sure that you're doing what works for you, what's comfortable for you, whatever you feel comfortable with, as long as you're protecting yourself in the way that you see fit.
Vanessa Castro, and I'm actually taking a social media break. But you all can definitely reach me via email, vanessa.castro@hrc.org. Happy to answer any questions. I think my words of wisdom are, no matter your situation, you're not alone. You've got folks in your corner. We're here to support you. Find those people who are going to be in your corner and who are going to support you. We have the resources, we have the means, just reach out. So know that even if you feel like a situation, like you know what your options are, find those people who are going to support you through that, because there are folks in your corner who are ready to help you.
Jalen Hibbert. You can email me at Jaylen, Jaylen, @reachla.org, reachla.org. And then you can ask me for my social media handles. But a last piece of advice I would have would be, I don't know if it's cliche, but I'm gonna say it, that you are more than your situation, you're more than your status, you're more than who and what people say you are. So, yeah, I want to end it with one thing that my coach used to say: good, better, best. Never let it rest till your good gets better and your better gets best. So just know that we all are working pieces, and you're more than your situation.
Well, skin folks, kinfolk, and all folks, you have just experienced another insightful, impactful, community-led and bred episode of When Does It End? We hope you come and see us again. And until we meet again, leave with love. Talk to you soon. Bye, y'all.